Epilepsy is a chronic neurological disorder in which there is abnormal, excessive, hypersynchronous electrical discharges happening in the brain, and which in turn result to what is called a seizure. Seizure in common terms also called as fit. Now, there are many types of seizure. The commonest variety is called generalized tonic-clonic seizure. There's another variety called absence seizure, where the patient doesn't have any jerky movements of the hands or legs, but just have a staring look, which doesn't last beyond 10 to 30 seconds. And then we have a seizure in which the discharge is not spread entirely in the brain, but happens in only part of the brain. So that's why the symptoms of a fit are also occurring into one part of the body. They are called as focal seizures. Suppose if there is a jerking only of the one hand, jerking only of the thumb, there could be jerking only of the face. So in this, the corresponding area of the brain on the opposite side is excessively discharging electrical impulses. At the same time, they are not spreading through the entire brain, thereby not resulting in a generalized tonic-clonic seizure. Now, these focal seizure can occur with or without impaired consciousness also. There are many causes for epilepsy in the early age, in especially neonatal age and infantile age, and up to 5 to 10 years. The most common causes are the perinatal birth asphyxia, the process of delivery in the antenatal period. There can be reduced oxygen supply to the brain, and they require lead to the brain damage. If you come later on in the adulthood, the commonest cause is the genetical causes, the idiopathic generalized epilepsy, what is called as commonly. And they can also head trauma, road traffic accidents also contribute to significant extent. Then brain infections, meningitis, and particularly in our country, a parasitic infection called neurocysticercosis and tuberculosis of the brain, both can lead to seizures and then subsequently epilepsy. Then when you reach the later age of the life, brain tumors also form a significant proportion of patients with epilepsy, and even strokes, both ischemic strokes and hemorrhagic strokes, both of them can also lead to epilepsy. So epilepsy is not an uncommon condition. There are several causes. There are many anti-epileptic drugs available to treat the patient with epilepsy. Only about less than 5% to 10% of cases with epilepsy do not respond to medical management. Then they might be amenable to surgery also.